to you. If you have any issues, kindly type it and inform right at that same moment. Okay. So, The Man Who Was a Hospital is actually a story by Jerome K. Jerome. And Jerome K. Jerome, whose original name is Jerome Clarka Jerome, was an English writer, and he was best known for his humorous work, Three Men in a Boat, which was published in the year 1889. And the one that is being prescribed for you, that is The Man Who Was a Hospital, is an example of Jerome's fine humor. And you will realize that there is some sort of exaggeration in this story, but even then, it is based on sound observation of human behavior. So, right at the beginning, I think you can see the screen, and the first photo is that of Jerome K. Jerome, and he is known throughout the world for this book, that is Three Men in a Boat. A copy of the same is available in our library. If you get time, kindly go and have a read. It is a hilarious book. Okay, it is a travelogue, a comic travelogue. So, coming to our story, The Man Who Was a Hospital. So, he begins the story by telling that it was my liver that was out of order. And he tells us how he came to know that it was his liver that was out of order. How he came to know about it? Because he tells us that I had been just reading a patent liver pill circular in which were detailed the various symptoms by which a man could tell when his liver was out of order. So, what do you mean by a patent liver pill circular? So, actually, circular is a sheet that is often posted or handed out on the street advertising something. So here, a patent Liverpool circular means a sheet that is posted or handed out on the street to the people advertising a patented pill. By patented pill, what he means is a government approved pill. Pill means a tablet for the health of the river. So one day he happened to read a circular about a patent liver pill, and in which the various symptoms of liver disorders were detailed, and he happened to read everything, and he came to the conclusion that he had everything. I had them all, means I had all the symptoms mentioned in that circular, and as a result he came to the conclusion that he was suffering from liver disorder. Is it clear, children? Okay. So, right at the beginning, the narrator, what do you mean by narrator? The person who narrates the story tells us that his liver was out of order, and he came to know about it by reading a patent liver pill circular. And in that circular, the various symptoms associated with liver disorders were given, and he found that he has been suffering from all those for a long time, and he concluded that his liver was out of order. Okay, it is the most extraordinary thing, but I never read a patent medicine advertisement without being impelled to the conclusion that I am suffering from the particular disease, therein dealt with in its most virulent form. Virulent means in its most severe or in its most harmful form. So he tells us that it is something extraordinary that happened, but he tells that, but I never read a patent medicine, means he always used to read this patent medicine advertisements, and whenever he read it, he came to the conclusion that he was suffering from a particular disease that was mentioned in that circular. So this man is in the habit of reading this circulars related to several diseases, and so it is a habit in the case of this narrator. And whenever he read such circulars, he came to the conclusion that he was suffering from that particular disease, and that too in its most severe form. So the diagnosis seems in every case to correspond exactly with all the sensations that I have ever felt. So he used to feel that the symptoms mentioned in those circular corresponded to the sensations that he used to have. And from those sensations, he concluded that he too was having those diseases. So now he tells us that one day he happened to visit the British Museum. So in the British Museum, there is a library, the British Museum Library, and I hope you know it contains one of the world's largest collection of books. So one day this man happened to visit the British Museum, and what was his intention to visit the British Museum? To read up the treatment for some slight ailment of which I had a touch of hay fever, I fancy it was. So this man thought that he was having hay fever. So hay fever is actually a sort of allergy caused by dust or pollen. And as he was suffering from hay fever, he took the decision to visit the British Museum. And what was his intention? Just to get some treatments for that. And I got down the book. So he took a book, maybe an encyclopedia, wherein all the diseases, its symptoms, and its treatment were given. And also, one thing that you have to notice, that in that particular book, everything is arranged in the alphabetical order. From that, we can conclude that maybe it is an encyclopedia. So I got down the book and read all I came to read. And then, in an unthinking moment, I idly turned the leaves and began to indolently study diseases generally. See, so he was looking for the treatment for hay fever, and after reading it, ideally he turned the leaves, means without thinking about the consequences, he turned the leaves. Leaves means the pages of the book, and began to indolently means in a very lazy manner or in an idle manner, he began to study the various diseases mentioned in that book. And what happened? I forget which was the first distemper. Distemper means the viral disease. I forgot which was the first distemper I plunged into. Means he forgot which was the first disease that he came to read other than hay fever. And what happened? Yeah, see, devastating scourge means when he read it, he understood that it was a persistent trouble. Means if you are inflicted with that particular disease, definitely it is going to be a persistent trouble throughout your life. Definitely you will suffer throughout your life if you are going to have that viral disease. I know. And before I had glanced down half the list of premonitory symptoms. Premonitory means the warning symptoms associated with a disease. It was borne in upon me that I had fairly got it. So he came to the museum just to understand what are the treatment associated with hay fever. But in an idle moment, what did he do? He began to turn the leaves, and he came across some distemper, means some viral disease, and he doesn't remember which disease it was. And one thing he was sure, if you happen to have that disease, it is going to be a persistent trouble throughout your life. And when he went through the premonitory symptoms, it was clear for him that he was suffering from that. He was sure that he had fairly got it. So now, which are the diseases he is suffering from? One is liver disorder. He believes that he is suffering from liver disorder. The second one, hay fever. Now, the third one, he tells us that he is having some sort of distemper. So, distemper means some sort of viral infection, and he's not remembering what's the name of that particular disease. Okay, so I sat for a while, frozen with horror. So he was frozen with horror, means he was really afraid when he came to realize that he was really frightened when he came to realize that he was suffering from such a distemper, because throughout your life you will be troubling because of that particular disease. You will be having trouble because of that particular disease. And what happened? In the listlessness of despair, means he was filled with despair, he was very desperate, and he again turned over the pages. So he didn't stop with that, but what did he do? He began to turn over the leaves. He began to turn over the pages, means he studied other diseases, and in an unthinking moment, he began to read the book, and that too in the alphabetical order. So let us see what happened. See, he began to turn over the pages, and he came to typhoid fever. I hope you know what typhoid fever is. So typhoid, it is a bacterial disease, and he came to typhoid fever, and he read the symptoms, and he discovered that he had typhoid fever too. And he also realized that he must have had it for months without knowing it, wondered what else I had got. So now he realized that he is having typhoid also, typhoid fever. And he also realized that he has been having it for months, because when he read through the symptoms, he realized that all these symptoms are being with him for months. and then turned up to Sen Whitus dance. Means again he turned the leaves of the book and he came up to Sen Whitus dance. Sen Whitus dance, actually it is a kind of nervous disorder, and it affects our movement. Usually the immediate results can be seen in our face, hands and feet. Means there won't be any coordination in our movements will be jerking if we are inflicted with Sen Whitus dance. So he went through the symptoms of Sen Whitus dance, and as I expected, he was pretty sure about having that too. As I expected that I had that too, began to get interested in my case and determined to sift it to the bottom. Sift means to examine it to the bottom. So at first he was afraid to realize that he was having some sort of distemper, but now after realizing that he had typhoid, and now when he came to St. Vitus dance, even before going through the symptoms, he was pretty sure that he's going to have it. And what did he do? After that, what did he do? He was determined to sift it to the bottom. Means he was determined to examine each and every symptom associated with St. Vitus dance, and he began to read it to the bottom of that page, and so started alphabetically, read up again, and learned that I was sickening for it, and that the acute stage would commence in about another fortnight. So he began to go through the symptoms associated with St. Vitus dance, and after St. Vitus dance, what he did was he began to read the disease alphabetically. Means he began to read the book right from the beginning. So we know that he came to the library just to find some treatment for hay fever, and after that, while turning the leaves, he came across some random diseases, and when he went through the symptoms, he found that he was having some distemper, then typhoid fever, then after typhoid fever he found that he was having St. Vitus dance. But now he's not at all afraid or frightened, but now he is really interested, and he was sickening to have, means he was longing to have St. Vitus dance. And he also realized that within a fortnight, means within 2 weeks, the acute stage will begin. It is now not so severe, but within the span of 2 weeks, St. Vitus dance will become so acute. And then after, so he began to read alphabetically. Then the first disease after that he came to read was Bright's disease. So Bright disease is a kind of disease that affects our kidney. In modern medicine, it is called as I think nephritis. In modern medicine, it is known by the name nephritis. So he read the symptoms associated with Bright disease. I was relieved to find I had only in a modified form. So he was really happy to know that he was having Bright disease, but it was not so acute, but it was only in a modified form. And with that, he might live 4 years. And he came to the conclusion that as it was only in a modified form, so far as that was concerned, I might live for years. Means he has much time left because Bright disease is not going to take away his life. So the next disease that he came across was cholera. So now he came to see, and the next disease that he happened to read was cholera. And he tells us that cholera, it is a bacterial disease. And, once if we are contracted with it, it will cause a severe vomiting and diarrhea. And he tells us that cholera I had with severe complications. And he realizes that he has been having cholera for a long time, and it is also in a very complicated state. And diphtheria, see, the next he comes to the alphabet D, and in D he comes across the disease diphtheria. And diphtheria, it is a serious infection that affects our nose and throat. And he tells us that I seem to have been born with. So after going through the symptoms associated with diphtheria, he comes to the conclusion that since birth he has been having diphtheria. And I plodded means studied laboriously. I plodded conscientiously, means I plodded means I studied very thoroughly and attentively through the 26 lectures. Means I read the whole book, and the only malady I could conclude I had not got was housemaid's knee. So what is he trying to convey? He tells us that he has read the whole book, and he came to the conclusion that the only disease that he is not having was housemaid's knee. So what is housemaid's knee? It is actually a disease that affects our knee, and usually it happens when we knee often. It is something that happens due to excessive kneeling, and as a result of that, the front part of our knee will be inflamed, and housemaid's knee. And he realizes that the only disease that he doesn't have is housemaid's knee. And let us see what his reaction was. So what do you mean by malady? Malady means disease. So let us see what his reaction is when he came to realize that he is not having housemaid's knee. I felt rather hurt about this at first. So we have seen that when he came to realize that he was having some sort of distemper, at first he was frozen with fear. That was the term that he used. But now he tells us that now when he realized that he is not having housemaid's knee, he is rather hurt about this at first. It seemed somehow to be a sort of slight distortion. Sorry, it seemed somehow to be a sort of slight. Why hadn't I got housemaid's knee? Why this invidious reservation? See, he felt that it is a sort of invidious reservation. What do you mean by invidious reservation? Invidious means something unfair, something unpleasant. He thought that there is some sort of discrimination happening, and it is because of that unfair discrimination that he is not given housemaid's knee. All the other diseases in that book, he felt he was suffering from that. I reflected that I had every other known malady in the pharmacology, and I grew less selfish and determined to do without housemaid's knee. But now when he realized that he has almost all the other diseases known in pharmacology, he tells us, I became less selfish. Means and I determined to do without housemaid's knee. Okay, even if I don't have housemaid's knee, it is okay, but I am really happy that I have almost all the other diseases known in pharmacology. Now he tells us, yeah, gout in its most malignant stage, it would appear, had seized me without my being aware of it. See, again, he realized that he is suffering from gout. So gout, actually, it is a kind of disease that affects our joints. And as a result, our joints will swell, and it will result in inflammation of the joints. And it is really very painful. So he realized that he is suffering from gout right from a long time. And he is suffering from it, and it is in the most acute stage. And then cymosis, I had evidently been suffering with from boyhood. So now he has reached cymosis. Cymosis means the alphabet Z. So cymosis also is an infectious disease, and he realized that when he went through the symptoms associated with cymosis, he realized that he has been suffering from it right from his boyhood days. There were no more diseases after cymosis, and so I concluded there was nothing else the matter with me. So, as there were no more diseases after cymosis, means he had read the book from A to Z, and as there were no more diseases after cymosis, he concluded that there is nothing else the matter with me. Means I don't have any other disease other than those mentioned in this particular book. See, I sat and pondered. Means he began to think, and I thought, what an interesting case I must be from a medical point of view. So he began to think for himself, and he realized that from a medical point of view, he is a valuable asset. See, what an acquisition I should be to a class. Means I am a valuable acquisition to a class of medical students. See, I am a valuable asset to a class of medical students. Why? Students would have, yes, Rania, Hashim, do you have any doubt? Excuse me, Rania. Yeah, I do agree. During the pandemic situation, all of us are behaving somewhat like this, just like the narrator of the story. I do agree with that. Okay, so I think we can reserve the question answer section to the last part, or else it may not be easy to complete it within the time span. Okay, so he sat and pondered, and he realized that he was an interesting case from the point of view of the medical student, and he also realized that he was a valuable asset for the medical student. And students would have no need to walk the hospitals if they had me. So what made him think that he would be an acquisition to a class of medical students? Because he felt that if they had him as a patient, then there didn't be any need for the medical students to walk through the hospitals, because I was a hospital in myself. See, he has almost all the diseases, and so he concludes that he is a hospital in myself. All they need to do, all they means the medical students, all they need to do would be to walk around me, and after that take their diploma. So from the medical point of view, he believes that if they have him as a patient, he would be a valuable asset, and the medical students can just take their diploma after walking around him. Why? Because he has almost all the diseases known in pharmacology, and he calls himself as a hospital in himself. Okay, so see the change in attitude of that man, that narrator. At first he was afraid, but now he is very happy, and he believes that he is an acquisition to a class of medical students. And he was really sad about the fact that he was not having housemaid's knee. So all the other diseases known in pharmacology, he believes he has. See, then I wondered how long I had to live. See, as a man who has almost all the diseases known in pharmacology, now the next thought comes to him. What is it? How long am I to live? I tried to examine myself. I felt my pulse. See, you too can do the same. Just feel your pulse. Once when we do it for the first time, many of us won't be able to feel our pulse at all, and we will feel afraid as to whether our heart is beating or not. So the same happened to our narrator too. See, I felt my pulse. I couldn't at first feel any pulse at all. Then all of a sudden it seemed to start off. So after that, what did he do? He pulled out his watch and timed it. I made it 147 to the minute. See, you know, the normal heart rate is between 60 and 100. But in the case of this man, it was beating 147 to the minute. What does it show? He's really tensed. I tried to feel my heart. I couldn't feel my heart. It had stopped beating. Do you think that his heart had stopped beating? No, it is because of his tension. He couldn't feel his heart. I have since been induced to come to the opinion that it must have been there all the time and must have been beating, but I cannot account for it. But finally, he concludes that his heart is there and it is functioning. And the only thing is that he couldn't account for it, means he couldn't find, or he's not capable of feeling it. I patted myself all over my friend. What do you mean by patted myself? Means he tapped with the palm of his hand to check whether he is all right. He patted myself all over my friend. So he patted his own body, and from what I call my waist up to my head, and I went a bit round each side and a little way up the back. So he patted his own body, means he tapped with the palm of his hand just to see whether he is all right. And see the remark, but I could not feel or hear anything. But he couldn't feel or hear anything. You might have seen doctors doing the same, and when they do it, they will be able to understand whether we are having some sort of ailments or not. See, but here when he tapped, what could he couldn't feel or hear anything. I tried to look at my tongue. Then what did he do? So usually when we go to the doctor, they will ask us to, yeah, stick out our tongue. So here this man, instead of going to the doctor, he tried to look at his own tongue. Is it something easy? No. And remember, he didn't had any mirror before him. So I stuck it out as far as ever it would go, to whatever length we can bring out our tongue. So I stuck it out as far as ever it would go, and I shut one eye and tried to examine it with the other. Tried to do it. So all of you are listening to the class, just try to see your tongue with your eye. Is it possible? To some it will be possible, and the only thing we will be seeing is the tip of the tongue. And see, I could only see the tip, and the only thing that I could gain from that was to feel more certain than before that I had scarlet fever. So now, after sticking out his after sticking out his tongue, and after examining it with his own eyes, he came to the conclusion that he was suffering from what? Scarlet fever. So what is scarlet fever? So it is a kind of disease wherein if you are inflicted, we will get red rashes throughout our body, and at the same time we will be having sore throat and fever. So he felt that he is having scarlet fever too. So now what is his condition? I had walked into the reading room, a happy healthy man. I crawled out a decrepit wreck. See, I came into this museum as a healthy man, but now when I go out, I am a decrepit wreck. Decrepit means I am really weak and I am a worn out man. Wreck means I am totally ruined. I have almost all the diseases in this world, and I have now become a ruined man. So I went to my medical man. So means he went to his doctor. He's an old chum of mine. Old chum means an old friend of us, and feels my pulse and looks at my tongue. See, and what did the doctor do? Usually, all the doctors will do this. They will feel our pulse and they will look at our tongue and talks about the weather. All for nothing. When I fancy I am ill. See, the doctor didn't mention him or told him anything about the diseases that he was suffering from. Instead, he talked about the weather. And maybe our narrator might have felt that as he is having so many diseases, the doctor too might have avoided such a topic, because the doctor didn't want to disappoint him or didn't want to uh, make him desperate. See, so I thought I would do him a good turn by going to him now. What a doctor wants, I said, this practice he shall have me. So we are informed that the doctor is an old friend of the narrator, and our narrator believes that what a doctor needs is practice. So if the doctor have our narrator as his patient, definitely he will get more practice. See, he will get more practice out of me than out of 1700 of your ordinary commonplace patients with only one or two diseases each. See, the doctor may get 1700 of ordinary commonplace patients, means he may get 1700 patients, but he can make more money out of me than out of these 1700 patients. Why? Because our narrator firmly believes that he is a hospital in himself and he has all the diseases known to pharmacology. So I went straight up and saw him, and he said, well, what is the matter with you? So I went to my medical man, and my intention was to uh, do him some good, because I firmly believe that what a doctor needs is good practice, and the doctor can have more practice out of our narrator than out of 1700 ordinary commonplace patients. And when I went to my doctor, what did he say? He just asked me, what is the matter? And see the answer given by our narrator. I said, I will not take up your time, dear boy, with telling you what is the matter with me. See, I don't want to waste your time, because if I began to tell you what is the matter with me, what will happen? Life is brief and you may pass away before I had finished, because he believes that he has almost all the diseases. And if he goes on narrating all the symptoms associated with all these diseases, sometimes the doctor may pass away, means he may die before he finishes his list. But I will tell you what is not the matter with me. So it is better to tell you what is not the matter. I have not got housemaid's knee. Why I have not got housemaid's knee, I cannot tell you, but the fact remains that I have not got it. We have seen that when he read that encyclopedia, he was very desperate about the fact that he was not suffering from housemaid's knee, and he even felt that it is a sort of invidious reservation, means some sort of unfair discrimination was there, and it is because of that he was not given that particular disease. So we have seen that now he tells the doctor that the only thing that I don't have is housemaid's knee, and why I am not suffering from that, I don't know the answer, but it is the fact. Everything else, however, I have got almost all the other diseases I have. And I also told him how I came to discover it all. And our narrator told the doctor how he came to realize that he was suffering from all these diseases, how he came to realize that he happened to visit the British Museum Library and he happened to read the book. And when he went through that book on diseases and its symptoms, he felt that he was suffering from all those diseases, isn't it? So now, what did the doctor do? he opened me and looked down me, means he might have asked him to remove his shirt, and he examined him and clutched hold of my wrist, and then he hit me over the chest when I wasn't expecting it. A cowardly thing to do, I call it, and immediately afterwards butted me with the side of his head. So usually what a doctor does, he just examined the patient, and after that, what did the doctor do? He sat down and wrote out a prescription and folded it up and gave it to me, and I put it in my pocket and went out. I did not open it. Why? Because he knew that it contains almost all the medicines in this world, so he didn't have the courage to open it. He took the next thing that he did was, I didn't understand that. He took the prescription to the chemist. Chemist means a pharmacist, and he handed it in, and he gave the prescription to the pharmacist. The man read it and then handed it back. So the chemist, after reading the prescription, gave it back to our narrator, and he said he didn't keep it. Means why he didn't keep all those medicines? I said, you are a chemist, means aren't you a pharmacist, and don't you have these medicines? He said, I am a chemist. If I was a cooperative stores and family hotel combined, I might be able to oblige you. Being only a chemist hampers me. So what was the reply given by our chemist? See, if I was a cooperative stores and family hotel combined, I might be able to oblige you. Means I might have been able to do you this favor, or I might have been able to help you if I had a cooperative store and family hotel combined. But being a chemist hampers me, means being a chemist impedes me in giving you the things prescribed here, or it hinders me in giving you the things prescribed here. So now our narrator took the prescription and read it by himself. So it ran 1 pound of beef steak. So pound is a unit of measurement, just like our kilogram. So steak means a piece of beef. 1 pound of beef steak every 6 hours. Then 10-mile walk every morning, bed at 11 sharp every night, and don't stuff your head with things you don't understand. So this was the things prescribed in that prescription. So these are things that a chemist cannot give. And it mentioned that every day the narrator has to take good food, he has to take enough rest, and he has to exercise regularly, and most important, he should never stuff his head with things that he won't understand. I followed the directions with a happy result, speaking for myself that my life was preserved and is still going on. And the narrator concludes by telling us that he did whatever was mentioned in that prescription, and what is the result? He is very happy about the result, that even today his life is preserved despite having all those diseases, and it is still going on. And he firmly believes that it is because of routinely following that prescription that his life is still going on. I hope the text is or the story is clear to you. And if you have any queries, now we can answer. So actually, as I told you, it is a good example of Jerome's fine humor. And we may feel that the story is a bit exaggerated, but when we look closely, we can see that he is a man who observes human nature and human behavior. And the whole story is based upon how humans behave in different contexts. And as some of you have mentioned, every day we too are in the habit of reading several symptoms associated with the pandemic. And when we go through those symptoms, we do feel that are we having that? We too are afraid, isn't it? So the similar situations prevail throughout the world. And in the case of this particular narrator, he is, I think, much more eccentric, and he believes that he has almost all the diseases known in pharmacology. So is it clear? So now I think if you have any queries, you can post it in the question answer section. And yeah, definitely please give a brief summary of the book Three Men in a Boat. Yeah, one thing I would like to ask you is kindly type your names and your department, just to take down the attendance, just to know from which all departments we had participants. Okay, so when it comes to Three Men in a Boat, it is actually a travelogue that Jerome made with two of his friends. It is usually said that he began writing this book soon after his marriage and after his honeymoon trip with his wife. And in the actual book, what happened was that instead of his wife, he brought in two characters. The two characters are actually based on his friends, and those two friends replaced his wife. So the adventures they had is described in this particular book, Three Men in a Boat, and it is actually a journey that they make from Oxford to another place in London, and it is through the Thames River. And along with the three men, there is another uh, character that is a dog by the name Montmorency. Montmorency is the name of that dog. So the adventures that they have in that journey is being described in Three Men in a Boat, and it is a hilarious read. And definitely, when you get time, I do recommend each and everyone to read it. It is written in simple English, but it is really comical. And I think you can even have access it in the online as PDF format. In the PDF format, it is available. If interested, kindly go through it. Yeah, this is also an extract from Three Men in a Boat. It is actually uh, mm, this man is narrating an incident to his friends while they are on their voyage through the Thames River. It is actually an extract from Three Men in a Boat. I think you might have studied many extracts from Three Men in a Boat in your schools. Maybe Jesus from Liverpool, then Montmorency and the Tomcat. There are several episodes. So, and all of them are noted for that comical element in it. Okay. So, some of the questions that is asked is, why did the author suspect that his liver was out of order? What is the answer? Or how come Jerome began to realize that his liver was out of order? He came to read a patent Liverpool circular in which the symptoms associated with different liver diseases were given. And after going through those symptoms, he concluded that he was having liver disease, or he concluded that his liver was out of order. So why did the author go to the British Museum? So we know that he went to the British Museum library to find some treatment for hay fever, which he believed he was suffering from. Isn't it? Okay. Then what did the writer discover about his pulse? What did he discover? See, at first, when he tried to feel his pulse, he couldn't find his pulse. Then he felt that all on a sudden it seemed to start off, and he began to time it, and he counted that it made 147 to the minute. So it shows that he was highly tensed at that particular moment. Okay, I have seen another question from Vinayagan, and why was he saddened by the fact that he didn't had housemates? See, at first he was really afraid, or at first he was struck with fear when he came to realize that he was having some sort of distemper other than hay fever. And now what happened was, after going through the several diseases, he became very happy about the fact that he was having all those things. And when he came to realize that he was not having housemates knee, he was not ready to accept that. He felt that having it or possessing it was something that gave him some sort of recognition. And maybe because of that, he tells us that not having housemates knee was some sort of invidious reservation. He felt that it was because of some sort of invidious reservation that he was not given what housemates need. Is it clear? Okay, so shall I move on to the next question? Why was the author relieved after reading about Bright disease? Why was he relieved? Because after going through the symptoms associated with Bright disease, he felt or he realized that he was having it only in the modified form, and so that he can live for years with that disease. And so he felt a bit relieved after reading through Bright disease. So what was the the disease that the
I
author,
didn't understand.
what was the disease that the author found he didn't have? What was it? The author found that he did not have housemaid's knee. Then what diseases did he think he was suffering from? So it is a long list. The first thing was he believed that he was having liver disorder. Then he realized that he was having hay fever. Then some sort of distemper, typhoid fever, Senvitis dance, bright disease, cholera, diphtheria. Then what are the other diseases? Gout, cymosis, scarlet fever. So these are the diseases that he believed he was suffering from. Then what was the reaction of the author when he thought that he was suffering from all these diseases? So at first, when he realized that he was having some sort of distemper, he was frozen with fear. But after that, his reaction changed, and he felt that he was an interesting case from the medical point of view, and he also believed that he was a valuable asset to the medical students, because if they have him as a patient, then there is no need for the patients to walk around the hospitals in order to take a diploma. The only thing that they need to do is just walk around this man. After that, it will be easy for them to take their diploma. Okay, then how did the author detect that he had scarlet fever? So we have seen that he was examining his tongue with his own eyes. He stuck out his tongue as far it would go, and he shut one of his eyes and he tried to examine his own tongue with his eye, and he felt that though he could see only the tip of his tongue, he concluded that he was suffering from scarlet fever. So these are some of the questions that are described, that are given for you in your text. Then another question that is being asked is, describe the visit to the doctor. So how is it described? So he visits his doctor, and we are also told that this doctor happened to be an old friend of this man, and again he believes that actually he is doing a good turn to the doctor, because what a doctor needs is practice, and if the doctor have him as his patient, it would be better than having 1700 patients. And again, the doctor examined him, and he wrote a prescription and gave it out. And when he took it to the chemist told him that if he was a cooperative stores and a family hotel combined, he would have been able to oblige him. But being only a chemist, it hinders him from giving everything that is being mentioned. Then this man read the prescription for himself, and he realized that the prescription, how it ran, it was mentioned that every day, every 6 hours, he has to take 1 pound of beef steak. Then every day he has to walk 10 miles, and he has to go to bed at sharp 11 o'clock, and he shouldn't stuff his head with things that he doesn't understand. So this was how his visit to the doctor. If you are asked to write about the visit to the doctor, you have to mention all these things. And what was the advice that the doctor gave? What was the advice? Not to stuff his head with things that he doesn't understand, isn't it? Then how was his visit to the chemist? We have seen that the chemist was not able to oblige him, because the things mentioned in the prescription are not there with the chemist. And he replied him that if he were a cooperative stores and family hotel combined, he would have been able to oblige him. Okay. Then why does he feel that he would be a wonderful acquisition from the medical point of view? We have already discussed that answer. And what is the answer? He felt that he was an interesting case, and he also believed that he is a valuable asset to the medical students. And as he is a hospital in himself, the medical students needn't walk through the hospitals. Instead, they can walk around him and take their diploma. And so he believed that he is a wonderful acquisition from the medical point of view. So these are some of the questions that is being asked in your text. So if you have any further queries, definitely you can ask me. Okay. Anything else? Any more questions? So if you have no more queries